So, good evening, everyone. Boa tarde. It's a really good pleasure to be here at the EAO, moderating this symposium. I have the easy task to present 5 unbelievable, amazing speakers. I want to thank Frank, Marcin, and the whole Straumann team for allowing me to be here and talk to you about introducing these speakers. So, today we're here to talk about immediacy. All right, so we're very happy to be here today talking about predictability and immediacy, how achieving predictable clinical outcomes in immediate implant protocols. Predictability and immediacy is the topic of the moment. You see Frank showed some data, and we want to talk about how to appropriate planning and use innovative techniques for immediacy. Now, nothing in medicine makes sense in the light of evolution, except in the light of evolution. So we have to evolve. The way osseointegration started many years ago, we looked at implant evolution. We looked at the implant materials, design, finish, status of the bone, surgical technique, and loading conditions. That evolved through Professor Schroeder's research and evolution on still the same topics: material design, finish, host bone, surgical technique, and loading conditions. That moved away to an evolution of the surface techniques, how Professor Boozer and all the research that came after that influenced surface characteristics on bone integration of titanium implants. Then this evolution of surface, we'll see now where it's leading to us to achieve not only immediacy function, but also fast osseointegration protocols. And this is all documented throughout 40 years, 45 years of treating patients and looking at osseointegration. Then we look at the implant designs. Frank already mentioned the implant design from external hexagon to tissue level, to the bone level taper, and now we have the BLX, which will be the main topic of our lectures today. And then we went into zirconia, into smaller diameters, into how these innovative surgical designs, implant designs, allow us to treat a larger number of patients with more predictability and less invasiveness. That evolved into the use of short, extra short, and narrow and extra narrow implants, all scientific-based evidence that we are used to work when we use these protocols and these products. And this is based on 40 years of history of developing this science behind all the materials we use today. Of course, abutments, how prosthetic connections work, how we can now tilt and angle implants, how we can now mill prosthetic components, how we can digitally plan everything, and through digital communication and allowing with this new surface and designs, we can achieve loading. So immediate loading has now a lot of time of scientific evidence, especially for fully edentulous static zone. Throughout this whole meeting, we saw a lot of evidence on immediate loading or immediate function or immediacy, even for static, for fully edentulous, or for partially edentulous. And now digital technologies. If we walk around the exhibits, all you'll see is digital technologies. How do we incorporate digital technologies to capture data, to diagnostic and integrate, to do treatment planning, to execute, but also to follow up the longevity of the patients, the longevity of the treatment, and how we integrate and look at the outcomes. And we are now learning, integrating this digital technology into these new tools. So all these topics will be discussed today with this list of amazing speakers, because they will talk about evolution as a new perspective, an integrated framework, and then bring some intellectual coherence to this medical education of this world of implantology that we work on. So I'm very proud and happy to present all the speakers. Professor Erik Salvesen will talk about planning to success digital workflow. Erik's from Stavanger, Norway. We'll have our 2 friends from Lithuania, Algirdas Pušys and Tomas Linkevičius. We'll talk about surgical and prosthetic aspects of immediate implant treatment with emphasis on the BLX. We have Professor Black Swart from South Africa, maxillofacial surgeon about tooth in 1 day, immediate finalization of dental implant, and Professor Bedrosian from San Francisco, California, talk about on 4 or on 6 decision-making for full arch restoration.